Good afternoon, everybody. Thank you for joining today's webinar on rural health advocacy as we prepare for the 55th session of the legislature, the first session. Just a quick statement of the purpose. What we're trying to do here is help rural health stakeholders prepare for the legislative session, develop expectations for it, and listen from two premier experts in the state of what their expectations are. I also want to emphasize that the timing of today's session is really important, with the governor delivering his State of the State message on Monday and the legislature starting on Monday. It's a very busy time, a very active time, and we really appreciate both Senator Quesada and Ms. Corriere for joining us today. To begin, we'd like to welcome members of the Arizona Rural Health Association, also members of the Arizona Telemedicine Program and the Southwest Telehealth Resource Center. We greatly appreciate their facilities. That's where the broadcast is taking place from. And then all the other participants from around the state. My name is Kevin Driesen, and I'm a board member with the Arizona Rural Health Association. And on their behalf, we welcome you all to today's discussion. In terms of quick tips and notes, you all should be on mute except for the speakers. You should have been muted when you joined the webinar. Time is reserved at the end of each of the presentations. Please use the chat function to ask questions and we'll read them off. And also we ask that you use the post-webinar, that you complete the post-webinar survey that comes to give us some feedback on your experience. The recording will be posted on the telemedicine program's website, and we'll also post it on our association's website as well. In terms of agenda, we have two speakers. We're going to shift the order a little bit to take advantage of people's time needs. We'll hear from Senator Martin Quesada concerning his expectations from the state Senate. And then we'll be hearing from Christina Corriere, the Senior Policy Advisor for Governor Ducey. We'll be talking about the governor's rural health priorities. Again, we'll be having questions at the end of each presentation. We ask that you use the chat box, the Zoom chat. You're welcome to email me as well, or certainly email Chris Martin at the address that's up on the screen. You can also text him if you have any technical problems in your participation today on the webinar. And then finally, as I mentioned, it will be posted, the video will be posted to the websites, the telemedicine program's websites and our own website. But perhaps most important in terms of follow-up is we really hope that our stakeholders get engaged in the process, that they make their voices be heard in terms of their preferences, that they speak with their legislators, they speak with the governor and let them know what your preferences are. It's people around the state up in Kingman and Flagstaff and Yuma and Lake Havasu, et cetera, down in Douglas. It's people that know what's best for your rural communities. It's important that your voices be heard. And so we really want to enable your engagement in the process. A quick statement just about the context of rural health here in the state. First of all, rural Arizona is really being hit hard by the COVID-19 pandemic crisis. I looked earlier today and on the state's website, the Department of Health Services website, and 5 rural counties have the highest rates of COVID infection in the state. And it is also, it's not only the infection, people being infected, but it's the health delivery systems that are affected as well. All the hospitals and the clinics are really being stretched in terms of their response. There's fewer services in rural communities, and so they're really stressed even more so in times of crisis. Just as some of the other bullets up there, the geographic distances make it harder for rural community populations to obtain some services. They'll have to travel long distances, especially for specialty services. There are fewer services. But one of the bigger impacts are the health personnel shortage areas. We have a shortage of doctors, of nurses, of pharmacists. There's an extreme acute shortage throughout most of the state. They're designated health professional shortage areas. It's harder, more difficult to deliver healthcare in rural Arizona, and that's resulted in a lot of vulnerability among the rural hospitals. And so it's a tough time around the state. It's a tough time for our state's health service providers. It's particularly tough in rural Arizona. With that, I'm going to introduce Senator Martin Quesada, who's our state senator from Legislative District 29. He currently is the minority whip for the Democratic Party and has committee assignments in government, judiciary, and rules. Last year, we understand he was on the Appropriations Committee. Before being a senator, he was a representative from 2012 to 2014. He received his law degree and Bachelor of Science from Arizona State University, and is generally considered really a strong leader in the progressive area of the legislature with strong interest in healthcare, immigration, and criminal justice reform. Senator Quesada, thanks for joining us.
Well, thank you, Kevin. I appreciate the association even inviting me to be a part of this and to speak to your wonderful group. And thank you, Christina, Ms. Corriere, for allowing me to skip the order here and go first. We're going to have to jump onto the floor a little bit later. I'm going to share my screen with you and talk a little bit, give you a presentation here, talk a little bit about some of the legislative priorities that we have as Democrats this year. And what we expect to see in the upcoming state Senate. But first, real quickly again, my name is Martin Quesada, and I am very honored to serve the people of Maryvale and Glendale in Legislative District 29. That's a part of Maricopa County, a part of West Phoenix, and all of South and West Glendale. And I represent those people now here in the state Senate, and I have for the last almost 10 years. So thank you. So here's my legislative priorities coming up for the next session. As Democrats as well, we are we've got a lot of issues that we want to cover this year, and what we've presented as Democrats for this year for our priorities is that we want to recover, we want to restore, and we want to rebuild our state. Now, obviously we want to expand justice, equity, and prosperity for all of Arizonans. That's primary, our primary focus as Democrats. But one of the main issues that we'll have to address is this pandemic that we're seeing. And I can tell you, as a legislator and as a school board member, I'm seeing the impacts of this pandemic in a major way. So that's something that definitely I want to address here as your legislator. Sorry, let me get that going here. Four big points that I wanted to make. We want to streamline our ineffective unemployment insurance program. We've got this program, and I can tell you as a legislator who represents a lot of people who are trying to get access to this program, it is unfortunately very ineffective right now. People are having difficulty accessing it. People are having difficulty getting those benefits that they're entitled to. And so we do need to streamline that program. We need to fix our inaccessible housing assistance program as well. Housing is going to be one of our main issues that we are going to have to address moving forward for the next several years in the state of Arizona. Housing is becoming much more expensive, much more inaccessible because of that cost. And the assistance that we give is going to become much more of an issue that our people are trying to access, and the need for that assistance is going to just get higher and higher every single year. In addition to that, we need to expand our access to childcare subsidies and food programs. That access to that childcare subsidy and childcare assistance is a huge barrier to a lot of working class families, not only in my district, but throughout the state of Arizona, especially in rural Arizona as well. Having that ability to have people take care of your children so that you can go out and go to work and get those jobs to put food on the table and to keep your lights on. And then access to those food programs as well. That's a huge need. Hunger and and poverty really as a greater issue are huge issues that we need to address as a state. So we need to expand that access to both of those programs. And then lastly, a fourth point that I'll mention is our small businesses. We need to help them stay afloat during this time. They're struggling, especially those smaller businesses that don't have that access to that capital and that those resources that they need to be able to withstand pandemics like this one right now. Our larger businesses, they're able to weather through this storm, but our smaller businesses can't. And so we need to help them stay afloat and really provide them the access, the resources that they need. So a big issue that we're going to face right now is housing, like I mentioned before. So some specific ways that we can address this is to limit legal evictions for non-payment of rent and material breaches of leases. There are, or material breaches of their lease. We can limit who gets evicted right now so that people aren't put out onto the street. And that's a huge issue because right now, even though there has been a moratorium in place, people are actually still getting evicted despite the fact that there is a moratorium in place. And what's happening is a lot of landlords know that they can still evict people, and the people they are evicting, they are evicting either don't know that they have rights, they don't know that they're able to stay in place, or they know that by the time they get access to the help that they need, to the resources they need, the information they need, that eviction will be done, and those people will just move on and try to find other options. And that's not right. That's not fair to those people. So we need to be stronger at limiting those legal evictions, especially for non-payment of rent, because people aren't able to make those payments right now. And we need to create a government that really prioritizes keeping everyone housed. In my opinion, I believe that housing is a human right. Everyone should have access to a home, or a roof over their head, and a place where they can call home. And right now, there are far too many people that don't have that human right now for housing. In addition, I'm a strong proponent of paid family and medical leave. I'm going to introduce a bill that will introduce that as a requirement in the state of Arizona to extend the allotted days that we can that a person can take to stay healthy. And right now, people are going to work when they are sick. They're going to work when their family is sick, and they're not being able to stay home and take care of them because they don't have that paid family medical leave in place right now to give them access to that leave. So we need to increase the percentage of wage replacements for workers, and we need to address the safeguards that safeguards for individuals who need to take that leave for reasons that are unforeseeable, and that happens a lot. A lot of that right now is and I even have family members that this is impacting right now, where they have a family member at home who is impacted by the COVID-19 virus, and they have to make a decision: do I stay home and help care for this family member, or do I go to work and kind of leave them on their own in hopes that they're going to get better and be able to stay healthy? That's a very difficult choice for people, and we shouldn't leave them to have to make that choice. So paid family medical leave, you should expect for me to drop a bill on that in the next couple of days. If not this week, then early next week, you should see the language for that. In addition, I'm also intending to address our minimum wage. We did pass an initiative just a few years ago to raise the minimum wage, but that minimum wage level is still at a level that is not a living wage. And people that are working full time at that new minimum wage amount now, it's still not livable. They're still not able to cover all of their expenses, and those are basic expenses like paying their rent, putting food on the table, and keeping their lights on at home, and even paying for air conditioning, during our hot summer months. So I do believe that that minimum wage needs to match the needs of the people of today. And right now, it's only matching the needs of people from a decade ago. So that's something that we do need to address. And I think that also we need to protect our children. We need to protect our kids. They're our most vulnerable in our community, and we need to take care of them. I'm going to drop a bill again this year that I introduced last year, and it actually made its way out of the Senate with a bipartisan vote. And that what that bill would have done would have repealed or banned all punishments for unpaid school lunch debts. And so what this is when kids aren't able to afford to pay for their lunch, their school lunches, a lot of times they go into debt, and families that have these debts, they're often having to pay that debt later when they're planning out paying their bills. And sometimes those kids go into debt for a period of time, a few weeks, sometimes a few months, before they're able to access that money to pay those debts. And so during that time when those bills aren't paid, those kids have a debt. And there have been a limited number, not all of them, thank goodness, but there have been a limited number of schools who have really implemented policies that would shame those kids that have those lunch debts. And so I introduced a bill that would repeal that practice or ban that practice in our schools. And it passed out of the Senate last year with a bipartisan vote. And it went over to the House, and they put it on an agenda to get heard in the House, which means it had bipartisan support there. But then we had to shut everything down because of COVID. So I'm hoping that we get movement on this bill again this year to ban any type of lunch shaming in our schools. In addition, the governor did talk about this in his State of the State yesterday, and I was really glad to hear it. But we need to expand broadband access to our rural communities, and especially in our schools. There's a huge digital divide right now, and the governor mentioned that he wanted to address this issue. I applaud that effort from our governor, and I'm anxious to see how exactly he wants to address that, because it is a priority for me as well, and for the Democratic caucus to address that digital divide. And lastly, we do need to make sure that we are supporting our teachers, our administrators, and our school staff in our public schools. I know that the governor has some different ideas about how to do that than we do, but I know that this is an issue that we all agree needs to be addressed. And my hope is that we can find a way to do that this year with the governor's office and with the Democrat and Republican legislators, is find a way to properly support and invest in our public schools. Because I serve as a school board member as well, and I can tell you that we have a huge need in terms of funding for our public schools, even with the passage of that proposition that was on the ballot this past year, the Invest in Ed initiative. Even with the passage of that, there's still a lot of unmet need for our schools and for our kids. So those are my priorities. It's actually some of my personal priorities as a legislator, but they are part of the priority package that our Senate Democrats are proposing this year as well. So I mixed in a little bit of both of those for you, but I would be happy to answer any questions about all of those, or any other things I'd like to hear from you about what we should be addressing as well.
Thank you. And again, we'd like people that have questions to submit those via the chat box, if you could do that. And as we're waiting, I have a couple, Senator, with the precautions, the COVID precautions and the protocols that are in place. We want to make sure people are well protected. And how are you seeing those protocols affecting the legislative process this year? And what contingencies are you looking at or preparing for in case something were to, some misfortune were to happen?
Yeah, Kevin, that's a great question. And I can tell you that, the Senate President proposed some COVID protocols that we were all going to follow for this year. And so far, I think they've been working pretty well. Obviously, there's some mask mandates for us as legislators, as staff, and people that are just around this Capitol. And there's also some social distancing. Yeah, there's your mask there. Social distancing that's required, and some virtual committee hearings, and the ability for us to go virtual on our floor voting as well. Some of the members have been taking advantage of that, and that process should allow for the public to participate virtually and in a limited way in person as well. I think that's the most important part, is for the public and for groups like your association to still participate in our process, whether it's virtually or in a limited in-person way. that as long as you have access to that, that's my main focus, and then keeping all of us and all of our staff healthy. So we did adopt some protocols. So far, they're working well. If they don't, if that process fails in the future, I know that we will work closely with the Senate President to find a way to ensure that everyone is kept safe and that there is access to the public to be able to address the issues that we're hearing in the Senate. And I'm confident we'll do that.
Reed. So we have from Kim Russell, Senator Quesada, I'm glad that broadband access is a priority for many legislators this year. Has there been assessments as to which rural and tribal communities have access to telehealth capabilities so that children and families can utilize this technology? Are there any goals attached to the legislation or priority communities?
Yeah, I know that, our rural and especially our tribal communities, for them to have that access to telehealth capabilities is a big issue. I can tell you that, as personally as a legislator, it's not my area of focus as a legislator, because I don't serve on the health committee where a lot of these issues are addressed. But I do know that my colleagues in this caucus are working on that issue, and as a caucus, it is a priority for all of us. But other members of this caucus, other than me, I serve on Judiciary and Government Committee. But the ones that are serving on that Health Committee and our Native American colleagues as well are hugely focused on that issue, and I know that they're working to find solutions to that as well. So yes, that is happening.
Okay. Stephen Jennings writes or asks, although 1% of the elderly live in long-term care facilities, 40% of the COVID deaths have been in them, and over 2,000 deaths so far in Arizona. Is now the time to extend blanket liability immunity to all long-term care facilities like a proposed bill may do?
Yeah, that's a great question as well. Thank you, Stephen, for that. I have some concerns about that, about extending that blanket liability immunity, and I haven't seen language to address that. I know the governor has talked about this in his State of the State as well. We saw some language that was introduced last year that I was not in support of, and I'm waiting to see what it looks like for this year. I haven't seen that yet, but a complete blanket liability immunity, I do not think is a good idea. I do think that some liability immunity is fair, and I think that there are some concerns that are out there for some businesses that we can address, but to make it a complete blanket immunity, I do not think is a good idea. So I think it would have to be limited in some ways, and also ensure that those businesses, especially like those ones that are those long-term facilities, that they are acting in good faith and they are following correct protocols to ensure that they keep their residents of those facilities healthy. And so I think that is the main thing. As long as we aren't allowing them to not follow rules that are keeping those people healthy, then I'm okay with adopting some sort of immunity for some from some lawsuits, but a blanket immunity, just complete blanket, I do not think is a good idea.
Okay. Well, we were foretold that you have to be someplace at half past, and you may have to be taking off pretty soon. We greatly appreciate your time and taking today time from your schedule, and thank you for all your service and for your work. I know it's a really crazy time, and it's you must be a very busy human being. So thank you for your time, Senator Quesada.
I definitely am, and thank you again for allowing me to speak with all of you. If you ever want to get in contact with me, please check out the Arizona Legislature's website. All my contact info is on there, and I would love to answer more questions or work with you on addressing any of these issues.
Very good. Thank you.
Thank you, sir.
Let me then introduce our second speaker. If I can, how would I get rid of that chat on this side?
Sorry.
So Christina Corriere is Governor Ducey's senior health policy advisor. Previously, she had worked with the Goldwater Institute and was chief of staff with Councilman DeCiccio. She holds a law degree and a bachelor's degree from Arizona State University. Ms. Corriere has participated in previous webinars with the telemedicine program, with the Arizona Rural Health Association, has been a very active person that has been very forthright in sharing her knowledge, and we appreciate again her time at what must be a very, very busy day. So Chris, will pass the baton over to yourself for sharing your thoughts. Thank you.
Thank you so much, and thank you for inviting me again. I'm happy to participate on this. They are all very busy days. This week has been especially busy with the State of the State on Monday. The governor will release his budget proposal on Friday, and between that, we opened the new mass vaccination site out at State Farm Arena. So it's definitely been busy. The governor's office is a little different than the legislature. In the legislature, they'll introduce well over 1,000 bills and usually send up about 300 to 400 of those bills for consideration by the governor. The governor's office is much more limited in the number of bills that we actively present to the legislature as something that the governor wants to work on. So for instance, last session, the major bill that the governor had in the healthcare area, and one of the bills that made it through before the legislature adjourned due to COVID, was a bill that was called the Mental Health Omnibus, also referred to as Jake's Law, related to mental health parity. So similar to that large omnibus last year, I will have a large omnibus that I'll be working on behalf of the governor for this year. And I think it aligns very well with this group. I suspect the name of that bill will be the Telehealth Omnibus. So the entire bill will be related to the issue of telemedicine. This is something that the governor has been looking at closely throughout this pandemic. He's issued 4 or 5 executive orders that touch on the issue of telemedicine, everything from expanding the provider types that are able to engage in telemedicine, ensuring payment parity for providers so they get paid the same whether it's an in-person or telemedicine, to allow audio only, to allow telemedicine in the workers' comp space, et cetera. So all of those executive orders expire at the conclusion of the public health emergency. We are today still in a public health emergency. I could not tell you at what date that will conclude, but we feel that it's necessary to take some of the things that we've done during the emergency and make them permanent in the area of telehealth. People have come to rely on them. Delivery of healthcare this way is safe and effective. It brings more options to our rural community. It helps individuals who may be immunocompromised to not have to go out, and it can reduce the wait times to get service. So that is what we want to do. The bill will cover many of the things that were in the executive order, so it will ensure that payment parity continues. This is really important because a doctor's office doesn't reduce their expenses or their footprint just because some of their appointments are delivered via telehealth rather than in person. It also allows the doctor's office to be able to invest in the infrastructure necessary to smoothly provide telehealth. It will allow audio only to continue based on a patient's preference, a patient's lack of access or ability to use technology, or a lack of broadband for that patient. We know that this is important for our rural areas for a couple of reasons. One, their broadband access just might be less. It's also important to individuals who may be lower income and not have access to a smartphone, to a tablet, to a computer, as well as to some of our elderly who may not be low income, but may not be as adept at technology as their younger counterparts. So we want to allow that to continue. We know this will increase access to specialists. It will allow our rural hospitals to be able to do some unique partnerships with specialists here in the Valley. We're also looking at allowing for some telemedicine across state lines. In Arizona, we have a lot of winter visitors. If you come here for 2 or 3 months out of the year from, say, Iowa, where I'm from, or from Ohio, where the governor's from, and you want to be able to reach your doctor back home, there is no reason that your doctor back home shouldn't be able to provide a telehealth service to you here. If you live in Mojave County and your closest hospital for children's specialty is Las Vegas Children's instead of Phoenix Children's, and you want to do a follow-up appointment with that doctor, you should be able to do that. But even telehealth within the state can really change lives of individuals. We're going to be putting out, the governor did his state of the state earlier this week, and usually state of the states are very policy heavy. They're a list of what they'd like to see this coming session. It was a bit of a different flavor this year and talked mostly about the pandemic, but because we do want folks to know what policies we'll be working on, either today or tomorrow, we will be putting out a policy document that outlines what we'll be working on. And it will specifically highlight telehealth, and it will include a story of one family and the life-changing effects for telemedicine for them. This particular family lives in Yuma. Their daughter has a lot of significant health issues such that she needs a variety of specialists that are only available at Phoenix Children's. For the past 6 years, the family has had to drive from Yuma to Phoenix up to 4 times a week. That's a 6-hour round trip drive. You can imagine how disruptive that is to life. Mom has limited options to be able to work outside the home when that's occurring. The daughter has limited opportunities for a regular education. Since the governor's executive orders and payment runs to invest in the telehealth infrastructure, that family now only has to come to Phoenix 1 time a month. So you can imagine how life-changing that is for the family. So we believe that telehealth is good for the providers. We believe that telehealth can be good for families and individuals, and we want to make sure that option remains. We are also going to be working on the issue of broadband. We know that broadband is important to healthcare delivery, it is important to education, and it is important to economic development. So that won't be in the same bill. Bills are supposed to be single subject, and again, because broadband touches a whole lot of areas, that would be something that would be handled separately, but you'll see that highlighted in the governor's policy booklet as it comes out as well. So those will be the main issues from our office that we'll be working on. From us, we will certainly be working with the legislature on other bills as they arise. Outside of the legislative area, we will be focusing on implementation of last year's mental health omnibus and parity for mental health. And we are working on vaccine distribution, which presents some unique challenges in rural Arizona. So we are hoping and working with our federal partners to increase the supply of Moderna vaccine coming to us, because we know that many of our rural counties have expressed either a strong preference or an only preference for receiving Moderna, both for the reason that its temperature is easier, that it must be stored at is easier to handle, but also the quantities that it must be ordered in are easier to handle as well. So we're looking to shortly activate our retail pharmacy partnership to make the vaccine available in more of our retail pharmacies. And we are looking at how and when we can expand to doctors' offices as well. I am happy to stop there because I feel like people get more out of question and answer, and turn it over to that if that's okay with you, Kevin.
That's fine. And although I'm getting quite a bit from what you're saying, it's a lot of good information. There are a couple questions that have been posed, and then I have a couple as well. Leah Myers asks or states, thank you so much for including audio only in this bill. It's so important in frontier areas and with people who don't have technology skills or resources. That's a comment from Leah Myers.
We completely agree. And I think that on that one, you know, there's some people that have a level of concern. Specifically, I think insurance companies worry about audio only and the value in that. So I would really strongly encourage you to share that thought and with the legislature as the bill comes up for consideration.
Okay. And then Kim Russell asks, does the omnibus bill also address connectors between the client and the healthcare professional? I suspect that some clients may need assistance utilizing telehealth technology. I'm thinking about how community health workers might be used in this regard, as they usually interface with clients more regularly.
So this issue hasn't come up before, but Kim, I'm happy to talk to you about it. I have asked specifically to our doctors and our behavioral health providers how telemedicine has worked in a teaming approach where you might have an acute care provider as well as a behavioral health provider or maybe a DD provider. And they've actually said that it makes the whole process go smoother because it's really hard to get that whole team together in one office to meet with the patient, but it's a lot easier to get them in the same Zoom room to meet, and they did not see any barriers to teaming. The issue of community health workers hasn't come up, but I'm happy to have an offline discussion with you if there are barriers right now.
We have another one from Stephen Jennings. Stephen Jennings, is the administration likely to support the CDC's COVID recommendation to supply all those over 65 years and over and those with pre-existing conditions?
So in Arizona, we have an organization called VAPAC that reviews the vaccine advisory recommendations, and then they make a recommendation to the Department of Health on whether or not they support it. So we asked the Department of Health yesterday to send out a polling question to VAPAC to gauge their level of support, because it is something that we are looking at doing, and they are all to have their responses to us today. So I think you can expect to see some action on that shortly, but we have to go through the VAPAC process.
Okay. From Daniel Dirksen, perhaps?
Dr. Dirksen.
Dr. Dirksen. We've been hearing from both our rural and urban licensed health professionals with a scope of practice that includes giving vaccinations, but are very concerned they are not getting sufficient doses to meet the demand in their communities as the phases roll out.
Yes.
How can the governor's office help with the state health department and county health departments assure that both private physicians and those employed in rural and urban health clinics and federally qualified health centers are heard and responded to in meeting the needs of patients they care for?
Yeah, so this is going to be a challenge for a while to come. There is not enough vaccine today to give a vaccine to everyone who wants one. That is true in Arizona. That is true in every state in the nation, and that is true in every country in the world. We still have supply issues that are being worked through. Yesterday, there was an announcement at the federal level that HHS under the current administration is looking to push out some of the supply that the feds have been sitting on for second doses. The incoming Biden administration has announced that they have a similar approach. So we are hopeful that we will start getting a higher number of doses here in Arizona. As I sit here today, I couldn't tell you what that number is going to be. We're working with our federal partners to try to figure that out and get additional information. During phase 1A for healthcare providers and long-term residents, the amount of vaccine that was sent out to each county was pro rata, not based on the state population, but pro rata based on the population of the people in phase 1A. So if you had, say, 5% of the state's healthcare worker, or I'm sorry, 5% of the state's population but 4% of the state's healthcare workers, you would have gotten a 4% share for that. As we move into phase 1B, they are being readjusted for the population percentage that you have for your phase 1B, and will continue to adjust as we move through that. We know that there are some particularities, say for our border counties, where they have Customs and Border Patrol individuals who are not included in the federal allotment. We have to make adjustments for that at the state level. So we're trying to make the adjustment that we can there. As soon as we have more vaccine, we will send it out. There's nobody that wants to see a vaccine sitting in a freezer. It does nobody any good until it gets into somebody's arm. With these vaccines, there's, as you all know, there are two of them. Pfizer requires minus 170C, which is minus 104F. For that reason, there are counties that do not have access to the ultra cold freezers, and they have said that they do not want Pfizer, they want only Moderna. Moreover, the Pfizer vaccinations, they come in a box of 975, and you can't split that box between two locations, which also makes it a challenge to get it to a doctor's office, where they would have to go through not only keeping it at the ultra cold temperature, but going through 975 doses in a 10-day period. A huge challenge. That's why there's so much demand on Moderna, which right now is only half of the vaccines that are coming in. Moderna, you can keep at a more reasonable minus 20 temperature, and you can order it in multiples of 50 instead of multiples of 75. So our rural counties all want Moderna. You add to the demand of Moderna that in 1A, it was not only the healthcare workers, it was the long-term care facilities. The way that we get to long-term care facilities is through something called the pharmacy partnership. So this is something that CVS and Walgreens and other large pharmacies are signed up for. The long-term care facilities said, yes, I want to be in the pharmacy partnership. They were given a partner, whether it was a Walgreens or a CVS that was within 70 miles or so. That Walgreens or CVS will go out and actually administer all of the doses to the residents of the long-term care facility and to the staff there. That pharmacy partnership also requires Moderna. So we are having to send Moderna to our rural counties. We're having to send Moderna to the pharmacy partnership to get our long-term care centers vaccinated. That's why at these big sites, we're only using Pfizer. But as we get more Moderna, we will send more Moderna to our rural counties. We will activate our retail pharmacy partnership so that it's available where folks actually go. And we are working on activating it for doctors' offices as well, with the understanding that for the vast majority of doctors' offices, the only one they're going to be able to take is Moderna, not Pfizer. Did I answer your question, or do you have any follow-up, Dan?
Dan did right. He said, thanks, Christina. Pro rata allocation makes sense, and we appreciate what Dr. Christ, you and Governor Ducey and the leadership in county health departments are doing to accelerate this process in an equitable manner. Now, he may have something else to say, but it sounds like it was. Now, with the opening of the football stadium distribution up in Phoenix, are you changing your allocation protocols? Or is that still, are you going according to phasing it?
So we're not. We allocated some of what would normally go to Maricopa County to the Department of Health to run that site. So they are using only Pfizer vaccine that would otherwise be allocated to Maricopa County. But
still following priority populations?
Yes, it only is being given to individuals that are in 1A, a healthcare worker that somehow didn't already get vaccinated, or they're in the 1B priority, which is currently 75 years of age and older, law enforcement, and teachers.
Okay. Let me take advantage of not having questions in the queue right now. And I was really happy to hear you talk about the omnibus mental health bill from last year. And in reading the governor's state of the state, he was very eloquent, I thought, when he talked about the impact of the pandemic on everybody's mental health, from kids all the way up to adults, and for a variety of reasons, substance abuse and suicide, et cetera. How is that mental health omnibus bill gonna strengthen our mental health system? What's your vision for that?
Yeah, so two things. One that's already out there and just started and we're really excited about, and then one that's an ongoing project. So the first that's what's ongoing, we have to write the rules for how we're going to enforce mental health parity. Those will not be in effect until January of 2022. They are in the process of being drafted right now. We have an advisory committee that we have put together to help create those rules. And it's very interesting because at the Department of Insurance, they're used to hearing from the people they regulate. They're used to hearing from the insurance company. So they've never had a large advisory committee like this that actually includes A, providers, and B, family members who have had to try to access the behavioral health system through commercial insurance. So that group is working. We have our next meeting on Friday. I expect we'll have those draft rules published probably sometime next month. So I would encourage you all to watch that and provide your comments on it. We appreciate the public comment. One of the things that as we were working through the mental health omnibus and why it became an omnibus instead of just a parity bill is we realized that while we need this time to effectively implement a law, that doesn't mean that people aren't going to need help in the interim. And so we created something that we called the Children's Behavioral Health Fund. And so we put $8 million into this. This is a new fund that's run out of Access. So if you have a child who is not eligible for Access, but has a mental health need that's been identified by the school, they are able to actually refer that child to the fund, and the fund will pay for their behavioral health treatment if they are uninsured or underinsured. So they can help with deductibles, they can help with co-pays. So this fund is active right now. When we created it, 8 million was a guess. We had no idea how much it would take to cover this until those rules are in place. So we're going to be watching that carefully over the next several months. It's similar to the fund that we created in the opioid bill, the Substance Use Disorder Fund, which does the same thing. It pays co-pays and deductibles for people that are underinsured, as well as full treatment for individuals who are uninsured and not eligible for Access. And that fund, we put $10 million in back in, I want to say 2018. And that fund is dwindling, which is a good thing. It means it's been used a lot. So we're looking at potentially refilling some funds into that fund as well this year.
And those rules would be published by Access or by?
No, by the Department of Insurance and Financial Institutions. Okay. There will be rules that will be published from the Department of Health a little later on hospital discharge, because one other piece in the mental health omnibus required the Department of Health Services to adopt rules for discharge for patients that are hospitalized either for a suicide attempt or who have expressed suicidal ideation while inpatient.
Okay. I neglected, Christina, to read Dan's second part of his response was the single dose vaccine with less stringent storage conditions on the Johnson & Johnson vaccine, though there's not as much as promised, is hopefully coming soon, and that should be very helpful.
Yeah, we're looking forward to additional vaccines being in the system. I know that J&J is one. Some people are expecting it in the March timeframe. We're not entirely certain when that will come. We're also watching developments with the AstraZeneca vaccine as well.
Christine, we're approaching the end of the hour and we appreciate your time. I've got one tough question I'd like to, a little bit of a hardball question to throw at you. And the governor's emphasis on lowering income tax rates in the State of the State speech seems inconsistent with his declaration to address the pandemic and all the catch-up requirements for education and everything else that he identified as needs. So it just seemed inconsistent, the push to lower income tax rates. And how do you reconcile that? How would you explain that?
Well, first, I would say I'm not the tax advisor, so I'm not going to be able to go into detail on that. However, I would say that is consistent with what the governor has said ever since he ran. I would also say that our state funds are in much better shape than the rest of the states that I have seen. We will actually have additional funds, both in terms of federal ones this year through enhanced Medicaid matches, et cetera, as well as some increased state funds over what was expected. So I think that when he lays out his budget, which will come out on Friday, you will see a balanced budget that covers all of the needs of the state while allowing for the proposals that he'll lay out.
Okay. Michelle Crow asked, what's the age eligibility of new children's behavioral health fund?
I'm trying to remember if it was 19 or 20 or if we took the age away, but it's anybody who's enrolled in the public school, I think up to age 19 or 20, I'd have to go back and look. They have to have that referral from the school system.
Okay. We'll watch for that. And I would be remiss if I didn't ask. I know last year the governor supported the grandparent foster care stipend increase. And it just didn't, I think it made it through the House. It didn't make it through the Senate. Are there indications, will he be supportive of that again this year to bring grandparent foster care stipends up?
That was in his budget last year. Unfortunately, it's that time of year where I have to irritate everybody because his budget's not out, and I get asked about it multiple times, and I have to say the same thing, which is that I never get ahead of the governor on what's in or not in the budget. But the budget will be released on Friday afternoon, and if you have questions, I'd be certainly happy to address those at that point. But I can't get ahead of the governor.
Okay. Well, I'm sure you have a lot of input in terms of steering him in the direction. So you're behind him to get in front of him. So in a way, you are ahead of him. But thank you so much. I don't see any other questions. I have several others, but I can write them to you. It's getting to be that time of the end of the hour. We want to greatly express our appreciation, Christina. For several years now, you've been joining us, and we really appreciate the clarity of your voice and what the information that you provide.
Well, thank you. And if I could just give my email, if anybody has questions on the telehealth bill or anything else, you are all welcome to reach out to me directly. If you want to schedule a private call or Zoom meeting, I'm happy to do that too. You can reach me at ccorieri@az.gov. So it's just ccorieri@az.gov.
Thanks, Christina.
Thank you.
So in terms of next steps, did I get out of? How do I get my? I've gotten back. So here we go. Next steps. I'm trying to get.
Yes.
I got one slide up. There we go. Next steps. We encourage everybody to become familiar. If you're not already using the AZ Ledge website, we have on our website, in partnership with Empowerment Systems up in Apache Junction, we've created an instructional video of how to use AC Ledge, but it's a very, very powerful tool to enable your contact, direct communication with your legislators, find out what committees they're on, look at committee agendas, track legislation, and even view committee meetings live. So we encourage you to get on the AZ Ledge website. Also, the Center for Rural Health has organized a Rural and Public Health Policy Forum on February 1st and 2nd, which is always an excellent event to hear about what is going on up at the state capitol. We encourage you to enroll on that. You can get more on their website. At the national level, the National Rural Health Associations is very active in advocating for federal health policy. Their Rural Health Policy Summit is on February 9th through the 11th. And that includes remote Capitol Hill visits. And we have one of our board members is trying to set up those visits with the senators and some of the congressional staff. So please feel free to enroll in that Rural Health Policy Summit or visit our website, let us know, and we may be able to help sponsor you to participate in that or to participate through our organization, the Rural Health Association. And then more information, recording of this video will be posted to the telemedicine's website, to our website as well at the Rural Health Association. And on behalf of the Arizona Rural Health Association, the Arizona Telemedicine Program, and the Southwest Telehealth Resource Center, we want to thank you for your participation and also give a plug to the excellent people at the telemedicine program for helping make all the connections work well. Thank you very much.